everyone, I'm Dr. Z. Welcome to the open house. Come on in. Now what we're going to do is a filler demonstration, and Jean is our perfect candidate here for temple filler. As we age, we get a little volume loss in our temples. It's concave, if you will, and then when we're younger it's more of a convex surface. So that's what we're looking for, and I actually have had this done on myself. It's been years. This usually stays a few years in the temples. So we're going to go ahead and get started. So if you would, just relax back for me. And no talking, don't bite down, relax your jaw. Okay, you're gonna feel a little pinch. Pinch, 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 pinch. Good. Great, doing great. Almost done. The worst part is just the sensation, and sometimes you can hear the filler, but it's not really painful. And then the recovery, there's really no recovery. You may be a little bit sore for about 24 to 36 hours. Okay, good. And you can see it gives a little fullness here. It's very subtle, but it really makes a difference. So what I say is just don't go home and eat a steak. Softer foods for about, like I said, 24 to 36 hours. And you can, if you need to, you can take a Tylenol for pain, but you're really not gonna need anything. You really notice it when you go lay down at night and there are no distractions. Then you'll go, I feel a little soreness here. But other than that, you're fine. All right, so how was it?
Painless.
Painless? Oh, I like
Perfect.
painless. Oh, good, good,
Great.
good, good. So we're gonna do the other side. We won't let you go around lopsided.
Thank you.
And then you may do this once every couple of years, usually. Now, there are some people who are super, super thin or are really good at exercise and they run a lot, and joggers, they tend to eat it up a little bit more, but generally about every 2 years or so.
Wow. All right.
Okay,
Thanks.
good. All right, thank you. Now we're going to talk about relaxant. Relaxant is Botox, Xeomin, Dysport, and Jeuveau. There are 4 now on the market. I like them all. They all really work the same. I have a few little favorites. Dysport is one of my favorite. I like the way it diffuses. But again, they all work the same and I love them all. So one of the areas that I think is forgotten about more often than not is the neck. I especially see it on TV with reporters, and they do a beautiful job of taking care of their face. And then they just forget the neck, and it's a disparity there, and their skin is beautiful here, smooth, and then it gets wrinkled on the neck. So don't forget your neck. I do my neck every time I get my Botox done or Dysport done, which is about every 3 months. When you're younger, you may not need it as often. You may need it twice a year. Everybody's different. But I do recommend starting it in your mid-30s. I think that's when you need to start it. And then, and we just kind of go over the neck. Sometimes we just do the jawline, whatever anybody needs. So this is Mary's first time to get it done on her neck. So let me get everything going. And we like to do a little ice. Ice makes everything better. You start seeing the effects in 2 days, but you get the full results in 10 days to 2 weeks. And everything's just a little smoother. Now you see these horizontal lines here. Sometimes people have them a lot more deeply etched in. And it can be from looking down at a TV, at a monitor, at your phone, at an iPad. So what we can do is, we do the relaxant, then we can do Ultherapy, which helps tighten it. We can do Profound, which helps tighten it. And even Sublative, you know, that's one of my favorite procedures. I do it every 3 months. So there are things you can do in addition to the relaxant to keep your neck looking good. And again, I recommend doing something to your skin every 3 months in addition to the relaxant. So again, you'll start noticing the difference in about 2 to 3 days, but full results in 10 days. You did great, thank you. This is one of my favorite procedures. I know they're all my favorite because it all makes your skin look good, but this is Ulthera. Ulthera is a procedure, I actually had it done a month ago for my face and neck. It helps tighten the skin by delivering heat. And if you'll see on that screen over there, at the very top, you can see an ultrasound image, and we can deliver heat to the specified layers of the skin that we want to. So sometimes we go a little deeper, maybe 4 millimeters. Sometimes we go a little more superficial, 1 to 3 millimeters. And we may do 3 different levels on one area of the skin, whether it be the cheeks, around the eyes, your neck area. And so right now we're doing under the chin because sometimes our skin gets a little lax here under the chin. I know for me, I had to do it twice underneath the skin initially, underneath my chin initially, and now I do it every year maintenance. Why is Ulthera so good? Ulthera is wonderful because there's no downtime. You're not bruised. You may have a mild swelling, but it bypasses the skin surface. So we numb you up. So we've already numbed up Kim. How are you doing? You doing okay?
Doing great.
Okay, good. So Bryn is using a certain transducer that goes to a certain depth that delivers the heat. And once that heat is delivered, it stimulates collagen production. Remember, I always say it's all about your collagen. We want your collagen thick. We want a lot of collagen in your skin. Collagen gives us the plumpness of our skin. So this is going to help tighten here under the chin. We're going to go all around here under the jawline back here. And then we can even go onto the cheeks later. We can do around the mouth. This is a very versatile machine. Again, probably mid-30s. You may want to think about it, doing it once every 5 years. Everybody's different. It depends on how much sun damage you have. But this one, you can think about it in your mid-30s. In your 40s, you're probably going to want to do this every 2 years. Then in your 50s, I think every year. Again, Ulthera is a great machine. We do have to numb you up. So Kim has had topical numbing on, and then I came back and did injections. If we're going to do your whole face, we're going to give you a little sedation to make you comfortable, and you're going to have a driver. But then you go home, you're not bruised, and you can go to work the next day. So, great procedure. Hey everyone, this is one of my newest procedures. It's new to Z Dermatology this year. It's called Profound. I have already had it done. It is fabulous. I bought this machine for me, but I'm going to use it on my patients too. And today, usually it's done for the face and neck, and it's skin tightening. Skin tightening, but there's some downtime with it. You get some bruising. So like I talked about Ulthera earlier, Ulthera is a great machine also, and there's no downtime. Profound, you get a little more tightening, but you got to do the downtime. So nowadays with masks, it really doesn't matter if we do the face and neck, but the abdomen is a great spot. And I did this to me about 3 months ago, or I had Heather do it to me about 3 months ago. What it does is it tightens that skin. And you can see these needles are being, or these prongs are being deployed inside the skin, and there are pairs of prongs, and they're wonderful. You're in no pain. We've numbed you up so she doesn't feel anything. And then heat is distributed between those 2 prongs. You already know about heat. Heat stimulates collagen. It's all about the collagen. So we're tightening the skin surface. So this machine has 2 hand pieces, one for skin tightening and the second one for cellulite. We love to treat the cellulite. You can do some on the abdomen. You can treat some fat on the abdomen. But it's really great for the thighs, the banana roll, which is underneath the buttocks there on that gluteal fold, and the buttocks itself. This one leaves a little bit of bruising, like I said. So for about a week, you get some bruising. We can do a little procedure to decrease the bruising, the longevity, where it's about 3 days, an IPL. We can do an IPL immediately after, the next day, and the bruising goes away in half the time. But again, a nice procedure. Are you in much pain?
No, not at
Not at all. Okay. And again, it takes a little bit. You're here probably for a few hours. We inject the numbing medicine, and this is it delivers heat over about 3 to 4 seconds. So those prongs are in there a long time delivering the heat. That's what makes this machine so good. This is the best machine for skin tightening outside of surgery. It's a great one. I'm going to have it done probably every 2 to 4 years, depending on what other machines I'm using to tighten my skin. But again, downtime, bruising, but one shot does a great job. And this one, you get results at any age. Some of the other machines, you don't get as good a result the older you get. So women in their 70s, you may not be a candidate for Ulthera or some other skin tightening, but Profound, almost any age, almost any skin type too. Sometimes the thin skin we may not be able to do, but that's a very small percentage of our population, maybe 5%. 2 to 5% of my patients are not candidates for this procedure. This is a great one. Hey everyone, so this is a great room. This room freezes fat. We get rid of fat with no working out and no sweat. Too good to be true. I know, I didn't believe it at first either, but it really does work. There is a thing that fat is sensitive to cool more so than other tissue. Skin, bone, muscle, nerves, blood vessels. Fat freezes at a higher temperature than everything else. Why is that good? Well, we can bring the tissue down to that certain level where fat freezes and nothing else does. So that's what we do. So there's a cooling, actually we're doing dual sculpting right now, so we can do 2 sides at one time. So we're doing, it's kind of almost like the love handles, not quite, but there are 2 cooling plates, and the skin and fat is sucked in between those 2 cooling plates. And then over 35 to 45 minutes, it's cooled down to a certain temperature where the fat freezes. 25% of the fat that's in between those 2 plates freezes, and then your body slowly gets rid of it over the next 3 months. Now, what's so good about that? 25%. 25% is significant, and the good news is you never make any more fat cells. So once those fat cells are gone, they're gone. When you are born, you have a certain number of fat cells. You never make any new ones, and you die with that same number of fat cells. So what happens? How do you gain weight, or what happens with that fat? Those fat cells just expand as you gain weight. But once we kill the fat cells in a certain area, they don't get, when you gain weight, you do not gain that same amount of weight in that area because you don't have the same number of fat cells. But it's awesome. You can go work out right afterwards. You can go to dinner. You can go anywhere. There's no downtime, usually no bruising at all. And so you can see how much time is on there, Lisa?
32 minutes.
32 minutes. How are you feeling?
Great.
So initially there's a good suction, and it's a little bit, how would you say, pain-wise, on a scale of 1 to 10, 10 being the most pain. How much pain are you having?
Maybe a 3.
A 3, and that's initially. So we just put CC on the machine. So that's about a 3. Then it goes to nothing. You get numb. And you may have a little bit of swelling there for a week or so, and you start seeing the results in a month, full results 3 months. So what do you think, Lisa? I know you love cool sculpting. It's one of your favorite. You know, one of my favorite things, after you go through menopause, you distribute your fat a little bit differently. So if you had a tiny waist all your life, and once you go through menopause, you may have a little bit more fat around your waistline. This is a great way to get rid of that. We can just cool sculpt it off of there. You may need one here and here. You may need one back here. Some people are asymmetric. They may need one on one side or not the other. That's me. I know I just got marked. I'm going to have it done Monday with just on this side, on one side. That's all I needed. So everybody's different on what they need. We have so many different applicators. Look at all those applicators hanging on the wall. One size does not fit all, but we have your size, I guarantee. So one of the good things too, not just your belly, you can do your arms, you can do in between your thighs, you can do your chin area, and Anything else that I forget? Oh my gosh, outer thighs, back, the bra fat, and especially here too, the bra fat there, your back bra fat, and the banana rolls that are under the buttocks. Awesome. So if we can pinch it, we can get it. We can kill it.
Yeah.
All right, good. You still doing good?
Great.
All right, just by the time you get started, you're finished. It just doesn't take long at all. All right, see you soon. Hey everyone, this is one of our newest machines called Cool Tone. The machines just keep getting better and better. What's great about this machine? This machine helps your muscles get stronger with just laying in bed. It stimulates your muscles to make a contraction through magnetic muscle stimulation. It's really nice, and we can do it to the abdomen, we can do it to the anterior thighs, posterior thighs, even the buttocks area. And the good news is you're not sore the next day. You know, if you really do a great workout, you're really sore for a few days afterwards. I know that's been the case with me lately. But this way, we apply the applicator and then we leave it on there for about 30 minutes. That's all, 30 minutes. And it's 4 treatments total. And you have to have one day in between. So you could come in on a Monday and do it on a Wednesday or a Tuesday and a Thursday or a Wednesday and a Friday. But 2 treatments for 2 weeks in a row. And then you may choose to do a maintenance where you do once a month. This is a wonderful machine. So Lindsay's gonna put the machine, the applicator on, and then we're gonna start it up and we're gonna see. And it goes right over your clothes. Just have to wear thin clothes. And you can't have anything with metal in it. So no coins in your pocket, no zippers, anything like that. That's all right. Wonderful. I'll help you. And again, I like it for people who have back pain. Why? Because usually people with back pain, doctors are always saying, go ahead and strengthen your abdominal muscles. It helps hold in your core muscles because that helps with your back pain. It helps support your back. So this is a good way to work out your abdominal muscles for people who have back pain. So you can go ahead and start it, Lindsay.
All right, Sam, you ready? Yep.
Okay. So initially you're going to feel a little contraction and we're going to start low and then we're going to get a little bit higher, all the way to 100. And we start at 20.
So we have a 2-minute warm up.
So a lot of times we like to sculpt the abdomen down and with cool sculpting, get some of that fat off, and then we like to do the cool tone so that the muscles can strengthen and you do get some muscle show. You can't build the muscle and expect the muscle to show if you have too much fat on top. So some people really don't care about showing their muscle. They just want to get stronger. They want to feel better and they want to strengthen their core. Other people, they want to see more of a toned abdomen or thighs or buttocks for the summer season when you have to wear a swimsuit. Some people want that and it does a beautiful job. But if you don't, you don't have to do the cool sculpting, you don't have to do the cool tone. But if you do them together, it really is a nice result. So
Okay, Sam, we're going to go up.
Okay, it's been 2 minutes now.
I'm going to move you up after this contraction.
Okay, so do you feel that at all?
Yes.
A little bit?
Just a little bit.
Any pain?
No pain.
Okay, so as we increase it, you're gonna see a little bit or feel a little bit more stimulation. Mm-hmm. You feel it a little bit more?
Yes.
Hey everyone, it's Dr. Z again. And right now we're demonstrating Exceed. Exceed is a microneedling procedure. It's not just any microneedling procedure because I'm not a really big fan or haven't been before now on microneedling. Why? Because microneedling, some machines can traumatize your skin. It can actually cause redness or what we call neovascularization, where new blood vessels are formed and you get too much redness on your skin. So this machine is by Candela. Candela is one of the best manufacturers of lasers and machines. And this machine, you can see we're having it done now on your forehead. Are you in any pain?
Not at all.
Yay. She came in and had some numbing medicine put on about an hour before. And this machine, totally safe. We don't have to worry about contamination. Each head is taken off and disposed of and a new one is used. So no risk of contamination. And this one it glides on the skin, as you can see, and it swivels back and forth. I love this procedure. I have it done the week I have an event to do, or I'm going out of town for a convention, or I have a party to go to. It makes your skin glow, stimulates collagen. And it's all about stimulation of collagen. And different procedures deliver different heat, different downtime. This one is one of the few ones that really make a difference, but little to no downtime. You're gonna have a little blush, a little redness. But again, you're not in any pain?
Not at all.
Yay! I actually had this one done so we can do the face, the neck, the chest. I actually had my belly done. We're always worried about tightening skin, and sometimes there's some of the crepey skin you can get with this little microneedling device. So it's one of my favorite procedures. So Tran, how often do you recommend someone getting it done, or what are your thoughts?
I feel like you can get this every 4 weeks. I love it. It's really minimal downtime. The treatment, it gives your skin a great glow, and rejuvenates your skin with such a short downtime. It just looks the way the skin looks afterwards. So yes, you could do it every 4 weeks.
Wonderful. Yep, that's my thoughts. Love it. Microneedling, Exceed is the name brand, and it's by Candela. It's one of my favorite procedures. Hey everyone, as y'all know, if y'all have heard me talk before, this is one of my favorite procedures. This is called Sublative, and Leah here is performing the procedure. You can hear the little clicks. As you can see, it's not very painful because we've applied numbing medicine. So you come in an hour before the procedure, we put numbing medicine on, and then we do the procedure. What is the procedure? Well, these little bitty pins go into the skin, and then heat is delivered in between the pins. What does the heat do? The heat stimulates collagen. Your skin, the wrinkles, it's all about collagen. We want the most collagen we can get. This is my favorite procedure. I do it every 3 months on myself. It's the most bang for your buck with the least amount of downtime. I do mine usually on a Friday, and then I'm red and swollen over the weekend, although you can wear makeup the next day, and then I'm good to go to work on Monday. And we can do around the eyes, full face, around the mouth. I do the backs of my hands, my neck, and my chest whenever I get it done. I've done my legs, abdomen. I'm always trying new spots. And this is, how uncomfortable is it? On a scale of 1 to 10.
Not uncomfortable at all.
Not uncomfortable at all. Okay, great. Now what I like, well, as we get a little bit more mature, every 3 months, absolutely every 3 months. When you start the series, once a month for 3 months, because we're playing catch up. Some people, if you're starting in your 50s or 60s, you may need to do it once a month for 6 months. Everybody's different on where they start as far as their skin quality goes. But I agree, I like it once a month for 3 months for the initial series, and then based on your age, if you're in your 20s, you may need to do it once a year. 30s, every 6 months. 40s and beyond, every 3 months. So that's my guideline for this. But again, this is one of my favorite procedures. We actually have 4 of these machines because patients love it. They just come back and back and back. It's a real good machine for your skin. What does it do? Well, again, the heat stimulates collagen. It actually decreases your pore size. Don't we love that? Because as we age, our pores get bigger. When we're younger, we have a glow to our skin, and one of the reasons that we have a glow is because our skin's tighter, fuller, and the pores are smaller. So that light reflects back, and that's what gives you a glow. Helps great for the wrinkles here. On your upper eyelids, we are able to get too. There are not very many machines that we can get the upper eyelids with, so I love it there too. Sometimes we hit even the earlobes. You know, we don't want to forget those earlobes. Hey everybody. Now this procedure is also a great one. I love it. This is called plasma pen. Plasma pen is wonderful, and we're going to demonstrate as we do it. But it's great for little distinct areas of wrinkles. Here around the mouth, the fine lines around the mouth here, the smile lines. In front of the ear is a good place. And you'll see the little spark kind of that's happening there around the eye. And we're able to trace the wrinkles individually. And it's so precise, we're able to get super close to the eyelid margin. And this is one of the few procedures we can do this with. except like maybe with the CO2 laser, then I put in eye shields and I get super close to the eyelid margin, but then you're down for 2 weeks and you're healing for a month, maybe 2. No one has the ability for that downtime usually now. So this is a great procedure, because we can do the lower eyelid, we can do the upper eyelid. And then you heal, it takes about 3 to 5 days. You can usually wear makeup on about day 3. But again, 5 days, we get right up there close to that crepey skin. That's kind of what I'm starting to fight too. I'm gonna have this done in a few weeks. And then you may do this depending on how loose your skin is, how old you are when you start it. Again, usually maybe late 30s, early 40s, certainly in your 50s you're gonna need it. And you may do, if it's the first time you're getting it done, you may do it once a month for 3 months, and then you start on a maintenance. It's all about the maintenance, right? And so Stephanie, how often do you tell your patients, like Sean here, how often would you say, well, how many does she need and when would you recommend her coming back?
I think Sean would be a great candidate to do it 3 times. She does have some lines that come out a little bit crow's feet, that come down a little further. So she would do well with 3 treatments, like you said, spaced once a month, and then maintenance, maybe even just every 6 months to a year. To keep everything tightened. It's great for collagen production.
Right, it's all about the collagen.
Right.
The heat stimulates the collagen. So you need to be on vitamin C. Everybody needs to be on oral vitamin C. I recommend 1,000 milligrams twice a day. And I like extended release. So I always recommend to be on the collagen, to be on the vitamin C, because you can't make collagen without vitamin C. So, and it takes 3 months to make collagen. So you'll see immediate tightening, but the full results are in 3 months. So if you do 1 a month for 3 months, 3 months after the last procedure is when you're gonna see the full results. So this is one of my favorite procedures, and it's called plasma pen. Very safe, and these needles here are disposable. After this one, we throw it away. Again, you never have to risk contamination at Z Dermatology. And how comfortable are you?
I'm very comfortable.
Okay, so when we did around the mouth, on a scale of 1 to 10, 10 being the highest pain you've ever had, how much pain did you have when we did your mouth?
When she was doing my mouth, it was about a 2. But
Oh, okay. Okay, great, great. So it looks like it looks like a little mild sunburn. Would you say, Stephanie?
Right, a little redness and swelling maybe for 2 to 3 days, and then she will be able to put makeup on, like Dr. B said, on a third day, and be ready to go back to normal.
Yeah, love it. All right, well, I'm gonna let you get back. But again, plasma pen, great. And all of these videos we have online are on all of our social media accounts. And again, I'm gonna have it done in a few weeks. All right, thanks. Hey everyone, well, thank you for joining us on our virtual open house. I think we had fun tonight, and I think we learned a lot, and that's the most important thing. So we hope to see you soon. Bye-bye.